Hi, good afternoon, everyone. Just exhausting day going on. But yeah, it's okay. I was just feeling a little annoyed. I just got my vitamin D levels checked. I got a band-aid here, okay, because I got my blood test done. So when I came home yesterday, my son was like, "What is this, mama?" I was like, "It's a band-aid." And even I want it now. Where do I get a band-aid from? I'm like, this is when you have some injury, you put it. He's like, you see, my hand is also injured, put one band-aid on it. So I'm like, okay, now I have to go get small bandages. I have the bigger ones at home, but not the smaller, tiny ones. So yeah, my vitamin D level came and I was feeling a little of backache. So it came insufficient, just 20. Probably will have to take a shot for it. I hate injections. Anyways, let's just go ahead and solve another scenario-based question of Australian Dental Council exam. And this mock 2 is like predominantly prostho-based, and we have another prostho question, which is good because most of you all always feel that you are weak in prostho. And that's not your fault entirely, because our curriculum of BDS is structured the way and we are very less exposed to prostho clinically. Like, we do all those lab work more. I always feel prostho subject should be changed the way it is being taught in dental schools, and from year 1 itself you should be starting to get exposed to patients for prostho for a little bit while, apart from doing the lab work. Otherwise the first 2 years you're just doing the lab work, setting the occlusal, blah blah blah. Third year onwards you start seeing the patient, but you actually do not do a full complete denture until you are in internship, right? You just keep doing removable partial dentures, that too acrylic ones. So the amount of prostho clinically that is exposed to us is so limited that when you actually come to the clinical practice, you are like, hands are tied, you don't feel confident enough, and you then call a prosthodontist. So, and prostho is a vast subject. It has full FPD, RPD, implants, CPD. It's way too much to just master in a matter of 2 years. An internship 1 month, how much will you do? There's so many crown preparations that you should do to be confident about it. Nobody is confident about just BDS after BDS. Anyways, I have many times spoken about the complete denture parts, and I always say, go find a book, read about the denture problems after insertion, which itself is a huge topic, and clinically when you face it, you are just so flummoxed, I would say that's the right word, when a patient complains of something and you're like, what could be wrong, because everything seems to be right? So anyway, such questions of ADC will make you a better clinician and will help you to solve the questions as well. So let's study. A 64-year-old female presents to your clinic and complaining that recently she has a gagging reflex once she inserts her upper complete denture, which was constructed 2 months ago. The denture was fine for the first week. Now this line is so important, because this line will help you navigate through the trickiness of this question and the sub questions that are going to be asked. The denture was absolutely fine for the first 1 week. There was no problems at all. Problems started later on, okay? The patient's medical history showed that she is uncontrolled hypertensive and diabetic patient. She is uncontrolled hypertensive and diabetic. So she has underlying medical conditions. Now, why these medical conditions are important, especially the diabetes one? Diabetes is like a silent killer, It will go ahead affecting every part of your system. That is why you should never get diabetes. And if you have one, you should do some lifestyle changes to treat it. Because it won't create immediate problems, but in the long term, it's like slowly eating away your body, and one fine day when you realize nothing can't be done, slowly how a tree dies from inside and then ultimately breaks off. That is what diabetes does to all the systems in the body. And important systems in the body, like as such, every system in the body is important, but it affects your eyes, your kidneys, the basic functioning of your body gets screwed up. So she's having an underlying problem. So you have a patient. Now why this question is tricky is because the sub questions here are not just based on the scenario, it's based on basic dental questions also. And the one big mistake that all the candidates do in the exam is when they read a scenario, they are so absorbed in the scenario that they think all the sub questions that are going to be asked will be based on the scenario. That is where they do the biggest mistake. No, a scenario is given for you to know that this is the case, but the exam is also about to test your dental knowledge. So based on that scenario, keeping that as a reference, I can ask you a basic dental question. That basic dental question need not necessarily be connected to the scenario, but it may use the concept of the scenario. You understand my point? What I'm trying to say is that suppose I'm asking you about a complete denture. I've given you the situation about a complete denture. I can ask you any question related to complete denture which may not necessarily be related to this scenario. Why I'm stressing on this is that because the answer will differ, though the options will stay the same. You'll come to know why. So what did I tell you, which is the key line important here? The denture was fine for the first week, but she started complaining of gagging reflex. And the denture was delivered 2 months ago, and she's coming to you now with that problem. Now we all know, at least this much from complete denture, that whenever a patient has gag reflex, the first problem in the denture is because of the post-dam area, right? If it's overextended. Now, if I'm going to ask you the first sub-question, which denture fault could cause a gagging reflex? And you are very right to mark the answer of faulty post-dam, correct? But my next question itself is, when you check the denture post-dam area, it was okay, then what could be the reason? And in this, if I would have still given you the option of overextended posterior border, and you choose that, then you are very wrong. Then you are marking an answer wrong. Why? Why? In the first question, you marked it properly, faulty post-dam area, because the question asked which denture fault could cause a gagging reflex. This is a basic dental question. The first sub-question is not saying problem in the patient. It's just asking you a basic dental question, irrespective of the scenario. Which, it's like me, a dentist to a dentist, asking you, what is the most common problem if a patient is having a gag reflex? And you'll be like, check the post-dam area, probably it's overextended. Fair enough. But the next question is, when you have checked the post-dam area of the patient, it's okay. So now what could be the reason? And then if you choose still overextended posterior border, it's wrong. Because the question first of all says the post-dam area is okay. Second important line is that the question already mentioned the patient was fine for the first 1 week. Now, if there was an overextended posterior border, the patient would not have been fine in the first week itself. Immediately after delivery, the patient would have started complaining of gagging. And that did not happen. It started happening after 1 week. That means post-dam area is not the problem in this patient. Getting my point? The difference in the sub-question. So, do not be so absorbed in the scenario that you miss reading the sub-question and correlating it to whether it's a basic dental question or whether it is related to this scenario. Because whenever it is related to this scenario, answers can be thoroughly different, because in this scenario, there is medical complications, there is some other history which is given which can change your answer. You understand the point? So, yeah, when you check the denture post-dam area, it was okay. What could be the reason then? Then I cannot choose the answer of overextended posterior border. Increased vertical dimension, flabby tissue malocclusion. Increased vertical dimension, but not so much. Flabby tissues now. Malocclusion. In the order of the denture having a gag reflex, the first comes post-dam area, but since that was okay, the next is malocclusion. Why malocclusion? See, what happens when there is malocclusion, the denture becomes unstable and it becomes a little loose. So saliva kind of seeps in and it causes gagging. Now, the reason the postdam area is sealed properly is that, and if it's really nicely made, you know, when you try to pull the denture, there is such a big suctioning effect, you know, because it's kind of a vacuum and it's kind of sealed. There is no saliva seepage. But if that is loose, then saliva is going to seep in and it's gonna fall down because there is no more suctioning happening, because the denture got unstable due to malocclusion. The occlusion wasn't proper, so then the patient tends to bite. It fell. Why I'm not choosing increased vertical dimension? Because the first sign of increased vertical dimension would be the muscle pain. The muscles would be stretched. If I'm giving a denture which is causing the muscles to be like, always the muscles are open and stretched, the complaint would be pain in the cheeks, pain in the muscles, pain in the jaw, which increases as the day progresses because the patient is wearing the denture. That history is not mentioned, so I'm not going to go with increased vertical dimension. Got it? Side effect of antihypertensive include all of the following except. I like such questions because all of them will be right except one. These questions are way better than the questions which ask which is the best option, because then all the options are correct and you have to choose the best option. So whenever you get a question something like this, except, be happy. There can only be one answer. So side effect of antihypertensive includes all of the following. So let's see what can be the side effect of antihypertensive. Xerostomia, yes. Antihypertensive medications does cause xerostomia. Light chain reactions, yes. Neutropenia, yes. Increased gag reflex, no. There are many hypertensive patients and they all take antihypertensive medications and not all of them end up with increased gag reflex. So increased gag reflex is not the right answer. So that's a straightforward answer out here. Possible complication of the uncontrolled diabetes includes all of the following except again. So uncontrolled diabetes. Impaired wound healing, yes. Retinopathy, yes. Hypotension, I don't think so. End-stage renal failure, yes. Stroke, yes. Now, out of this, even if I did not know what is the answer, at least I know impaired wound healing happens because of uncontrolled diabetes. I know retinopathy happens. I know it affects the kidneys also. I know it can cause a stroke also. What I do not know if it causes hypotension or hypertension. So even if I did not know the answer, I would still choose hypertension because I know A, B, D and E does happen with uncontrolled diabetes. So sometimes when you don't know the answer, but here in this case I do know because I have searched, but I'm just telling you, if this question comes in the exam and say you were not aware of it, then you rule out by elimination. So then you choose what you know and you choose what you don't know, and mostly you'll be correct because that much at least you must have studied to understand the uncontrolled diabetes, that what it causes. So automatically what you have read, what it causes is not there in the option, then choose that as an answer. So here the answer is hypertension. What is the short and long term treatment for this patient? Very good. See, the long term treatment of any patient is overall health. The underlying medical conditions have to be addressed. And the short-term plan is always to relieve him of the problem, the chief complaint that has come to you for. So overall health of the body and the oral cavity is the long-term. So if the person is healthy, general checkups. If the person is not healthy, then you focus on treating that person holistically, or by referring to the medical practitioner, or motivating the patient to control the underlying systemic condition, because the oral cavity is of course related to the entire body, and the systemic diseases which affect the other organs, blood related issues, ultimately will affect your oral cavity and cause problems because it's connected, right? So the short and long term treatment for this patient. For short and long term, provide a better denture design. Better denture design is a short term option. It's not a long term option because it's not addressing my underlying medical conditions. For long term, treat the gingivitis and make sure the supporting tissues are in good condition. There is no mention of gingivitis. For long term, make sure her underlying systemic diseases are controlled. For short term, remount the denture and fix it. Yes. For short term, start systemic OHI. For long term, make a new denture. change to denture based material. See, all those options which have omitted the underlying medical conditions are not your right options, because this is your patient and you have to be bothered about the full general health of the patient as well. Just because you're a dentist doesn't mean you just focus yourself on the oral cavity. The oral cavity is after all related to the general body, so healing the general body is also going to heal your oral cavity. So short term, like I mentioned, is always to clear up the chief complaint, and long term is to make sure that the overall general health of the patient is maintained. So option C is the right option of choice. So I hope you have understood this. What I want you to do after this video is take out some time, go search for some PPTs on denture insertion problems, read about it. Whenever you are watching any one of my videos based on prosto, take it upon yourself to study prosto for a little bit more time on that day. Spend just 20-25 minutes, not more than that, after my video. Anyways, I make sure my videos are not long, like not more than 15-20, max 25 minutes. So since you are sitting to watch, might as well just sit for another 20-25 minutes. Anyways, the brain can function properly, attentively for 40-45 minutes. After that, it tends to get bored. So I'm not saying sit for 1 hour and make yourself go through something, but give yourself at least 20-25 minutes, see a presentation. Prosto is nothing but a subject, and since you have not studied many parts of it, because there were many other things to do as well, now you have the time, right? So study many presentations. Don't sit and study for 3-4 hours straight. I can never do that. I always, like, even now when I sit to study, which I make it a habit to do it daily, some or the other subject, max 30-35 minutes. Then I take a break of 10-15 minutes and I see if I want to sit again or not. So always set a timer. Wear a smartwatch if you want, and put a timer of 30-35 minutes. Sit, do that. Once the buzzer go up, stretch, drink water, 10 minutes break, come back, again put a timer for 30 minutes. Do not try to force yourself for an hour or so. Not possible. Your thoughts will go elsewhere. It will be more unproductive. I mean, that's how I studied for all my exams. And I studied myself. I rarely take coachings for my theory exams, because I feel I study myself the best and I see the results that come out through it. So my AIPG exam, my MFD exams, this ADC exam, name the exam, all high-end, very exhausting exams, I study by myself. And this method has worked like very beautifully for me. So just giving you a suggestion. Of course, whatever works best for you, you follow that. So I hope you liked this presentation, and I hope a little bit of concept is again cleared for the ADC exam. And yeah, leave your comments. I'm always happy to read them. And yeah, one more thing that I wanted to share was it's just a happy news. I never thought it would go, though I was kind of manifesting it. Just, you know, I feel happy doing that. So when I started this coaching, I think in year 2022 end, I guess, when I was giving my own ADC Part 2 exam, which I did last year. Wow, it's been a year. I appeared last May 15th, yeah. My mom's birthday is on May 15th, and I remember giving exam on that day. So last year, May 15. So just before that, I think I had started my coaching, and just yesterday or day before yesterday, I think, we almost crossed 200 candidates enrolled in my coaching. It's nice for people to approach, asking about the course, and then enrolling, and then being very happy with it. And it's not that I advertise anywhere that come and enroll in my course and I'm doing this and I'm doing that. No, it's just word of mouth. It's just the videos. It's just the goodwill. And yeah, it's become a daily part of my life now. Like every day when I go to sleep, I'm like, what video am I going to shoot next day? It's feel nice connected to you, you all. Like I mentioned, I'm just sitting here on my desk and it's like I'm talking to my desktop, but when I read your comments, I actually feel somebody's listening there. So it's all worth it. And there are days when I'm like exhausted or feeling low. You know, it's life. Everybody has things in their life. And then I suddenly read a message, somebody has messaged me from some part of the world that thank you so much for your videos, we are looking forward to more. It kind of gives me a nice boost also. So it's not just helping you all, this videos help me too, as you people get connected to me. It's nice to be part of your dreams, to help you all make a better clinician. I also become a better clinician every day when I speak about it. Because when I explain you all, things get feeded in my brains too, right? I dig into my own memory and I explain things which I have learned. Sometimes I also sit and do my own research that makes me learn a lot of other things too. So yeah, alright then, have a nice day, bye bye.